Hello and welcome to this Q&A with GP Dr. Andy. Today, Dr. Andy and I will be discussing winter triggers and lung health, changing symptoms and asthma attacks, steroid cards, and Dr. Andy will also be answering some of your questions too. Today's Q&A is brought to you by Asthma UK and the British Lung Foundation. My name is Joe Aldrich and today I'll be speaking with Dr. Andy, who's the in-house GP for both Asthma UK and the British Lung Foundation. Whether you have asthma or another lung condition, in this short session, Dr. Andy will be providing you with some useful hints and tips for staying well this winter. He'll be providing advice on what to do if you get ill during the festive season, and we'll be discussing what it means if you've recently received a steroid card. And please do stay tuned to the end because Dr. Andy will also be answering some of your questions too. If you need information about anything we discussed today, you can find lots of useful links in the description below. And remember, please do subscribe to our channel to make sure you don't miss out on the latest news and advice from us. Hello, Andy. Thank you so much for joining us today.
That's all right. Nice to see you.
We're going to go through a few questions for you, and then towards the end, I've been provided with some questions from our supporters who'd really like to ask you some questions.
Brilliant.
So I'm going to kick off with one to do with winter triggers. So winter can be a tricky time for people with asthma and with other lung conditions, as there's lots of triggers around. So could you tell us why people's asthma symptoms might feel worse at this time of year and what they can do about it?
Of course, thanks, Joe. So first thing, every one of my patients with asthma, COPD, bronchiectasis, or another lung condition, I tell them that they've got their own individual pattern of what their lungs do to them. So there's different ways that they get symptoms, whether it's coughing, wheezing, breathlessness, chest infections, but also the triggers that cause those are very different for everybody. Some people get more symptoms around hay fever and summertime, but winter can be a real big time for people getting triggers as well. And the sort of triggers we see, obviously the cold weather and the damp weather can cause problems for people. There's more sort of mold in the garden and in the air from sort of rotting vegetation and trees and things. And then as you come inside as well, that there's more dust as we put the central heating on. We're getting Christmas decorations out of the loft, which quite often have dust on as well, and that can be a trigger for people. And then people have Christmas trees, and Christmas trees themselves can cause problems. Some people it's pollens or the smells from the Christmas trees, and those things can be a big problem for some people. And then you add in scented candles and stress and some of the other things we do around Christmas, which again can just trigger some people's lungs off.
Aside from cancelling Christmas, Andy, is there a way that people can easily identify what their triggers might be?
So despite everything, I'm not wanting anybody to cancel Christmas. We just have to do it sensibly and do it in the right ways. So the first thing is take any preventative medication you've got regularly. This will help to protect you from any of these triggers, but also anything unpredictable as well that's out there, such as viruses and so on. Carry your reliever inhalers with you, those that you take to treat your symptoms, and carry an action plan or your management plan with you or a copy of it at all times. So if you do come into difficulties, it can give you some hints and tips as to what to do. And I think if you're aware of what your triggers are, then you can take some preventive measures to either avoid them or to reduce your contact with them. And I think that's really important to try and understand what affects your lungs. And I suppose the other thing about Christmas is just be aware of how Christmas is going to affect things if you start to get difficulties. So know when your GP surgery and your pharmacy are open. Make sure you've got enough medicines in the house just in case you do need them. You don't want to be running out this time of year. But if you do get difficulties, then know who to contact and where. So if you're at home or staying with relatives this Christmas, know where you can get help quickly. But you've always got 111 to fall back on if you're having difficulties. And of course, 999 is always there if you're in the middle of an asthma attack or if you're really struggling to breathe.
Great, thank you, Andy. The next question I've got for you is to do with people's symptoms. So if people feel like their symptoms have changed or they're getting worse over the festive period, or if they're having an asthma attack, what should people do?
So again, with all my patients, I ask them to sort of see what sets them off, see what is affecting their lungs, but also just to recognize the pattern of their triggers as well. So with asthma particularly, we know that if you're getting symptoms 3 or more times per week, it suggests there's some untreated inflammation in your airways, and you should be looking at your action plan or contacting your GP surgery to get more help with your asthma. Other lung conditions, you might get symptoms a bit more frequently. So it's about keeping an eye on what you know is normal for you, keeping an eye on your action plan or your management plan so you know what to do if things change, and making sure that you don't delay seeking help if things are getting worse. One of the hardest things as a GP or any other sort of doctor or nurse or pharmacist is treating people who've left it far too late. So the sooner you get help, the sooner we can help get on top of things. So have your action plan, whether it's asthma or for COPD or another condition. Know who to contact when you're struggling, and don't delay getting that advice so you know what to do next.
Excellent. I think that's a really useful piece of advice. I think all too often people leave it to the last minute, don't they, I guess?
But also at the minute, Joe, what we're finding is because of COVID, we're finding a lot of people don't want to bother the GP surgery because they think we're too busy or even closed. And although we will be closed for some days over Christmas, there is always a GP service there. So if you call your GP surgery or call 111, there's somebody there to help you and advise you. And even though GP surgeries are doing things like the vaccination at the moment, there's lots of other coughs and colds and other things that we're treating. Don't delay getting help because it can help keep you well and out of hospital.
Of course, that's great. Thank you. So the next question I've got for you, Andy, is one that we've been seeing quite a few inquiries through the helpline and on our website as well, and it relates to a different kind of card for this type of year, a steroid card. So we know that some people have been receiving steroid cards for their inhalers when they weren't expecting them. Could you tell us what they mean and why people might be getting them?
So yeah, steroid cards are not a new thing at all, but what's changed is the guidelines about when we give them out. So for people, well, going back, steroids are used really commonly in medicine to help treat some conditions, especially ones that cause inflammation. They're an essential part of treating some people with respiratory conditions as well. So people with asthma, some people with COPD need a steroid inhaler to help keep on top of any inflammation going on in their lungs. What we do know, though, is that for people who are on higher dose steroid tablets or they're taking very high doses of inhaled steroids, the body responds by shutting off its own supply of steroids. So the body makes its own natural steroids, and the medicines we take are just copies of that. Right. And the body recognizes when there's high doses of steroids in the body and doesn't produce any extra itself. That's not a problem because when we stop it, then starts making it again over time. However, if you're on high dose steroid tablets or high dose steroid inhalers and stop them suddenly, the body can go into a bit of a crisis. And because there's not enough steroid going around, it can even be life-threatening for some people, and the body really starts to panic and struggle. The reason we give out steroid cards is that, let's just say you took steroid tablets and were involved in a car crash, for example, and you went into A&E, they wouldn't know you're taking steroids. And because you were missing the steroids that we're prescribing you, and your body's not making enough steroids at the moment, your body goes into shock at the same time as trying to deal with an operation, with the trauma and all the other things that are going on. And it's really important that the medical team can see that card to know to give you extra treatment to keep you safe and alive. The other thing is if you're taking, whether it's high dose or normal dose steroids as an inhaler or tablets, as you've been prescribed, you must take them regularly. You must do it exactly as it's on the prescription. And certainly from time to time, I see people who are worried about the effects of steroids stopping and starting their medication because they want to reduce the effect of them. The downside to that is it means their body is more susceptible to feeling unwell, to actually needing steroids to try and get better. So it's really important if you're taking something regularly or it's been prescribed to you, you keep taking it as prescribed. What I would say is if you've had a steroid card, it's there for your protection. So carry it with you, carry in your wallet. Make sure that people around you know that you're on steroids as well. And if you're not sure whether you should have a steroid card or not, next time you're in your pharmacist or with your GP or with your respiratory nurse, have a chat to them and see whether you need one or not. But they're generally reserved for people who are on higher dose steroids for several weeks at a time, or on a very high dose of inhaled steroids for a long period of time as well.
Excellent. Would a GP or a pharmacist be able to actually give you the card, or do you have to apply for it?
You shouldn't have to do anything yourself, although you might want to prompt your GP or your pharmacist to see if you need one. But my computer system in the GP surgery flags up who needs it, and we print them up for those who need it. And historically, we've given them out, or pharmacists have done that as well.
Excellent. And I guess it goes back to your earlier point as well, particularly with the festive season coming up. Make sure that you've got your medicine that you require.
Yeah, and the biggest the sort of queries we've had in Asthma UK and British Lung Foundation about steroid cards is people wondering whether their steroids are therefore unsafe. The important message to say is it's stopping them suddenly that's unsafe. If you're given a course of steroid tablets for a week for your asthma attack or your COPD flare-up, take it as you've been prescribed. But if you're needing several weeks in a row, then that's when we need to think about slowly reducing it to allow your body to start producing steroids again naturally.
Excellent. I think that's really helpful. Thank you, Andy. If people want to have a chat to our respiratory nurse specialists or healthcare advisors here at Asthma UK and the British Lung Foundation, when can they do this over the festive period?
So first thing to say is if you've not heard of our helpline or spoken to any of our helpline nurses, they are really an amazing resource. I learn from them every time I spend time with them, and I'm in absolute awe of their passion, their knowledge, their commitment, and how much they care for the people who phone and contact them. And it's not just a helpline, they've also got WhatsApp as well. So for people who maybe don't have the time to sit down and chat on the phone to somebody, they can sort of put messages to and from with any simple queries. So this year they are closing for Christmas 2 p.m. on the 24th, so on Christmas Eve, and they're opening again on Monday the 4th of January at 9 a.m. So in between that time, they're not there to support you. Make sure you know who to contact otherwise. So your GP surgery, 111 is there, and don't forget that 999 in any emergency, or if you're having an asthma attack, if you're struggling to breathe, they're the people to call. Okay, so I hope that helps. We're only away for a few days, and we'll be back in the new year, bright and refreshed and able to help you.
Exactly. I think everyone needs a break at this time of year.
Definitely our nurses do. Thank you.
Definitely. I'm going to move on to some support questions now for you. So the first one comes from a lady called Yasmin. Yasmin has asked, are there any foods that are particularly good or bad for lung health? She goes on to say, I'm young and have non-cystic fibrosis, moderate disease bronchiectasis, and I'm also aiming to be more active. So what tips would you give me for this, please?
So firstly, thank you very much for that. I think this time of year, it's always great to be looking at what we're doing in the new year in terms of resolutions. So this is a really good question around that. In terms of people with respiratory disease, including non-CF bronchiectasis, the messages are very, very similar actually. So we encourage people to have plenty of fruit and vegetables, try and have more fresh food, and try and reduce sort of processed food as much as possible. And the reason for this is fruit and veg and fresh food have more nutrients in. And having a balanced diet, including all those nutrients, can help to give the body its tools to stay well, but also to fight things off like infections and disease. So it's really important to get a balance of things. Other things that people might sort of look at as New Year's resolutions is if you're a smoker, stop smoking. If you drink too much alcohol, that can affect your respiratory condition as well as being unhealthy. And actually trying to boost the amount of activity that you're doing. The British Lung Foundation webpage has got some really, really good bits on diet and some outstanding resources there on exercise. So I really encourage you to go and seek that out and have a look at it. So no matter whether you're already quite fit but want to get fitter, or if you are at the moment feeling extremely unfit and just want to try to do something to try and get your activity going, there's some really good sort of resources and videos and things on there to help try and get you, I suppose, off the sofa and a bit more fit. And being more active helps your lungs to work more effectively, which means you don't demand the oxygen so much, but it also means you can help control your weight, you can improve the efficiency of your muscles and bones, and can help to keep your overall well-being great and also boost mental health as well. So definitely worth doing. And I think for everybody with any respiratory condition, try and become more active in the new year.
Excellent. Thank you, Andy. Also worth mentioning that we'll be putting links in the comments section below for people who want to find them. So the next question is from Emma, who asks, what are your thoughts on someone with bronchiectasis who has been advised to shield having the jab? We're guessing that relates to the COVID jab in terms of the vaccination.
So firstly, I mean, everybody who's got a respiratory condition that's taking any medication, well, so asthma who's taking medication, and any other respiratory condition should be offered the flu jab every year. Some of those people will also be offered pneumonia jab, so definitely worth asking your GP or practice nurse whether you're entitled to have that as well. And then moving on to the COVID jab, it's all changing very quickly. We've got a long list of people that we want to prioritise to vaccinate first. And it's mainly the sort of very elderly, the over 80s at the moment, as well as healthcare professionals, people in nursing homes and care homes. And they're crucial that we look after them first. If you're in the shielding group, so you're extremely clinically vulnerable group, then you should also be getting the vaccine. We don't know where in the priority of things you'll be coming, but hopefully soon in the new year, we'll know more about what vaccines are available and how the NHS will be rolling them out to different groups. So if you're in that shielding group, then you're very, very likely to get a call sooner rather than later in the new year.
Excellent, thank you. So the next question is from Lorna, who says, hi, Dr. Andy. I have COPD. I was wondering if steam inhalation might help to clear my mucus. If so, what would you recommend I add to the water? I've heard that menthol crystals or eucalyptus might help.
So again, going back to what I recommend to so many people this time of year, even people without respiratory conditions get more mucus, they get sinus problems, they're producing more phlegm, and actually staying well hydrated, so drinking plenty of fluids, especially clear fluids, is really useful in stopping that from thickening up too much. But then also, things like steam can be really useful in helping just to lubricate it and help you get it up. However, everybody is different. And I know some patients of mine find that steam triggers off perhaps their asthma. And some people using things like eucalyptus or other sort of smelly things in it can also do the same. So I think first thing is be very, very cautious about what you do put in the steam. Simple things like having a bath or a shower can be a really good way just to get things moving. But after that, I'd say just be very, very cautious, because I see some people it can make them worse if you're adding menthol crystals or other things to the steam.
Excellent, thank you. So we've got a couple more to finish off with. These are from an unknown source. So I have severe asthma and I'm clinically extremely vulnerable. Will the new COVID-19 vaccine be safe for me to take? Also, I'm allergic to some medications.
So first thing to say is if you're in a clinically extremely vulnerable group, you should be invited in, hopefully soon in the new year, to get the vaccine. Every case is individual, so it's always worth just bouncing you back and saying, speak to your GP, your respiratory nurse, your consultant for more advice about whether you should have it or not. At the moment, the first jab coming out, the Pfizer one, we're being advised not to give it to people who've had an anaphylactic reaction. So that's a very serious reaction that needs adrenaline to help treat it. Lots of people call allergies or call things allergies when they're not. Some people who get common side effects call it an allergy, but actually an allergic reaction is one that causes rash, breathlessness, tightness in the chest, swelling of the mouth or lips in this case. But if you've got any doubt at all, we'd rather be safer rather than sorry. Speak to your own clinician about whether it's safe for you to have.
Great, thank you. And excuse me, lastly, would I be really ill if I catch COVID? I've got chronic asthma.
So what unfortunately, we've learned a lot about COVID over the last 9 months, and we didn't even know about it before then. And we know that some people without respiratory conditions or any other pre-existing conditions can be very ill or even die from this. So even if you're not in any of the at-risk groups, it can be very dangerous for people. Similarly, we know that people who are elderly, people who have got several long-term conditions, especially chest problems, it can really be a life-threatening problem for them. And that's why the people in a clinically extremely vulnerable group were advised to stay away from other people as much as possible, to self-isolate and to protect themselves as much as they could, really. Without knowing your case specifically, it's about taking all the adequate precautions that we're all taking. So washing your hands regularly with soap and water, or with some sort of sterilizing liquid. Wearing a mask when you're out and about, and this is not just protect you, but protect other people as well. Some people aren't able to wear that, but the majority of people are able to wear a mask. And then avoiding contacts with people as much as is possible. So following the advice in your local area and that the government are giving about going out and mixing with other people, going to other households. And especially if you have got a condition like severe asthma or another respiratory condition, make sure that you're doing everything you can to reduce the contact you're having with other people. If you are seeing other people, keep a safe distance away from them, follow all the hygiene precautions, and just really do everything you can to look after yourself. Now we've got the vaccine. We've been battling this for 9 months. Now we've got a vaccine coming. It'd be silly to throw it away now. Do everything you can to stay well. And then once you've got the vaccine in your system, and enough people have got the vaccine in the system, we can start getting ourselves back to normal and start worrying a little bit less about the possible effects of COVID. I hope that's answered your question. But yes, it's all very individual and very different. And we do know that with severe asthma, taking your regular medication helps to protect your lungs from COVID and helps protect you from getting asthma symptoms as well this time of year, so it can keep you out of hospital. So yeah, definitely keep doing that.
That's really great. Thank you, Andy. And I guess for people watching, if they've got individual questions, as you've said, they should contact their GP, or they can contact our helplines here at Asthma UK and the British Lung Foundation.
Exactly. And by knowing your case a bit more individually, whether it's as your GP or through the helpline, we can give you more specific advice just to help you out.
Great stuff. Andy, thank you so much for your time today, and thank you for answering all of those questions. I'm sure everybody watching will find them incredibly helpful.
Oh, I'm sure it has, and I'm sure there'll be a lot more questions coming off the back of it as well. So have a great Christmas, and I hope you all stay well and stay safe.
Thank you. Thank you so much, Andy, and thank you so much for watching today's Q&A with Dr. Andy, brought to you by Asthma UK and the British Lung Foundation. If you found what we've been discussing useful today, please like the video, comment and subscribe to our channel. As mentioned, you can find lots of useful links below, and if you're able, please do consider making a small donation today to help support the work of Asthma UK and the British Lung Foundation. Thank you again for watching, and we look forward to seeing you all again soon.